All right, it's 10 minutes after 8, and it's high time we talked about my colon. That's right. Over the holidays, as I mentioned on a previous show, I was in the hospital for a little bit. And long story short, at the end of my stay, it was determined that I had ulcerative colitis. And while I was going through this process of diagnosis and recovery, I began to notice that there was a lot of misinformation, a lot of assumptions about colitis and Crohn's disease and inflammatory bowel disease altogether. And so it sort of got into my head, and I thought, well, how many people might have this but might not know they have it, or think they have something else but have this, or haven't even thought to try and figure out if they've got it, and how many people are so sort of unaware of the symptoms that they wouldn't even know to look for it. So, to help clear the air, we have gone right to the expert, and joining me on the line right now is Dr. Kevin Glasgow, CEO of the Crohn's and Colitis Foundation of Canada. Doctor, how are you?
Very well, Jeff, and thank you very much for the opportunity to speak to you tonight about a condition that affects 1 in every 150 Canadians.
And that's kind of where I want to start with it. 1 in every 150 Canadians. That's a pretty staggering number.
It certainly is. Unfortunately, Jeff, as you're becoming increasingly aware, Canada has amongst the world's highest rates of ulcerative colitis and Crohn's disease, collectively referred to as inflammatory bowel disease. That's nearly 250,000 Canadians, and you are one of 55,000 Quebecers that has been diagnosed with this disease. And I'm sad to say that every year, 10,200 Canadians are newly diagnosed with either ulcerative colitis or Crohn's disease. So we have the world's highest rates of this disease. We jockey with New Zealand for that dubious distinction, so we really do need to do something about it.
We can take those Kiwis.
No, I think so.
So let's start at the beginning. Inflammatory bowel disease, there's sort of two forms of it. There is Crohn's disease and there is colitis. What's sort of the basic differences between the two?
So you're right, Jeff. The umbrella term is inflammatory bowel disease. So Crohn's disease and ulcerative colitis. Now, 3 fundamental differences. Crohn's disease, this is the way I remember it, affects gum to bum.
Oh, okay.
Anywhere in the gastrointestinal tract, from your mouth to your anus, gum to bum.
Okay.
Whereas ulcerative colitis affects only the large bowel or colon, hence the term colitis, so the lower part of your digestive tract. Second difference is that Crohn's disease affects the full thickness of the bowel. It goes right through the bowel wall, whereas ulcerative colitis affects the inner lining of the bowel.
Okay.
Third difference is that Crohn's disease is characterized by skip lesions, so bad bowel, normal bowel, bad bowel, normal bowel, whereas ulcerative colitis is continuous. There are no skip lesions.
Right.
And just to put a further point on this, about 10 to 15% of people with inflammatory bowel disease are diagnosed with so-called indeterminate IBD, inflammatory bowel disease. We're really not sure if it's going to develop into UC, ulcerative colitis, or into Crohn's disease. Only time will tell.
Okay, yeah, because that was something that I went through where they weren't sure which one it was going to be, kind of for a few days until they ran the right tests and all that. So they were treating it sort of as the undetermined inflammatory bowel disease.
And you're certainly not alone, Jeff. And as we learn more about these complex diseases that are caused by a combination of genetics, environmental triggers, microbes that leads to a dysregulated immune response where the body attacks the guts, we're realizing there is a blurring of the distinction between Crohn's disease and ulcerative colitis. And indeed, some of the medical experts and researchers whom we fund at the Crohn's and Colitis Foundation of Canada are so bold to say that perhaps 10, 15, 20 years from now, we won't use the terms ulcerative colitis or Crohn's disease. It'll be IBD type 1, 2, 3, 4, etc. So you're right, it is a bit of a confusing picture, and together we want to promote earlier diagnosis and moving on to the right sort of treatment. What
are some of the sort of early signs of an IBD that someone might mistake for something else? Like is it just stomach aches or other signs?
Some of the initial signs and symptoms can be quite nonspecific. For Crohn's disease, for example, often the first presentation is crampy abdominal pain, chronic diarrhea, weight loss, and ulcerative colitis. You may have that too, but sometimes it just presents as some blood in the stool. And let me emphasize, Jeff, if you've got blood in the stool, you must get this checked out by your physician. It could be simple as a hemorrhoid. It could be an infection. You have to rule out colorectal cancer, and certainly you have to include inflammatory bowel disease in the differential diagnosis. So I think I want to emphasize that IBD, inflammatory bowel disease, is an inflammatory disease. So when the gastroenterologist looks up in the bowel, either from the bottom or top, they will see inflammation of the bowel and ulcers. For example, that's where the name ulcerative colitis comes from. And this can lead to all sorts of complications, perforation of the bowel, lead to fistula formation, that is to say a connection between your bowel, the surface of your skin or other organs where stool shouldn't be. And as well, we're increasingly recognizing that in a substantial minority of people, these are actually systemic diseases. The effect isn't confined to the gut. There can be problems with the eyes, uveitis, the skin, with the joints, ankylosing spondylitis. So it is a systemic disease, and if you have any of those symptoms in association with bowel complaints, all the more reason to be checked out by your physician and to be an active advocate to make sure that you see a gastroenterologist, that is a doctor who specializes in gastrointestinal disorders. All
right. Let's talk a bit more about that when we come back, along with maybe some treatment ideas and what causes this whole thing. My guest is Dr. Kevin Glasgow, the CEO of the Crohn's and Colitis Foundation of Canada, and we will be right back in just a second, because right now it's 8:15 and it's nasty out there, so we got to get you some traffic. And traffic is brought to you by Gibby's. Enjoy a delicious dinner at Gibby's Restaurant in Old Montreal and Saint-Sever. Free valet parking. Now we head to the CJAD Traffic Center with Kira Yeager.
There was a friend of mine on murder.
Jeff Moss in for Barry Morgan tonight. We're here till 10 o'clock. And starting things off, we're talking about colitis and Crohn's disease, collectively known as inflammatory bowel disease. And we're just I'm speaking with, excuse me there, Dr. Kevin Glasgow, who's the CEO of the Crohn's and Colitis Foundation in Canada. And just for the break, we were talking about some of the differences between Crohn's and colitis. Now I want to ask you, Doctor, about some of the known causes of this disease, because this was the part that surprised me the most. When I would tell people that I was diagnosed with colitis, their immediate reaction was, oh, well, it must be all the bad food you eat.
Well, Jeff, I'm glad you brought up that point, because truth be known, we do not know what causes Crohn's disease or ulcerative colitis. Current theory is that it is a combination of genetics, and to date we've identified about 160 genes for Crohn's and ulcerative colitis. Some of these discoveries have been discovered here in Canada, funded by the Crohn's and Colitis Foundation of Canada and other funders. So genes, environmental triggers, and we believe that there is probably a critical period of exposure, perhaps in utero into the first year of life, and microbes. We know there has to be bacteria in the gut, because in mice models, murine models of inflammatory bowel disease, that these mice are specially bred to develop this. If you have them in a bubble, if they're sterile, no bacteria, they don't get it. Once you put bacteria in the environment, they develop the disease. So genetics, environment, and microbes, GEM. And again, these constellation of these three factors end up in resulting in a dysregulated or abnormal immune response, whereby the body attacks the gut, and this leads to the bleeding and inflammation. But we really don't know what this is. There are a lot of theories. In a northern country such as our own, because these diseases tend to be more common at the polar extremes, more common in Scandinavia, Canada. The farther south you go in the United States, the less common it becomes. So is it a lack of vitamin D in this gray, drab winter that we've been having? Is it something to do with their diet? We do know when people move from developing countries to Canada that their rates of disease go up. And these are communities that would tend to intermarry, so the gene pool didn't matter. So what changed when they came to Canada? So there are a lot of theories. The reality is, Jeff, it is likely that your constellation of genes, and it's a multigenetic disease, it's not one gene like cystic fibrosis, it's a constellation of genes, that you have a certain constellation of genes, and your environmental trigger, be that diet, lack of sunshine, something else, is probably different than someone else who has ulcerative colitis. It's very unique to the individual. So that's why it's so confusing. There's a lot of noise. The Crohn's and Colitis Foundation of Canada has a $5.5 million investment in the GEM project, the GEM project, Genetics Environmental Microbial Project, that's really intended to try to identify what the trigger is in genetically susceptible people, in this case to Crohn's disease. And thereby, if we can identify this, we can prevent this disease from happening. And you can check this out at ccfc.ca. There will be benefit to the ulcerative colitis community as well. So anybody who says they know what causes the disease, this is not a statement of fact. We do know some of the things that worsen the disease. In Crohn's disease, absolutely smoking worsens the disease, but it has not been proven to cause the disease.
Uh-huh. Well, that's good, because I enjoy hamburgers for breakfast. But,
Well,
I've been cutting
I'm not
back,
necessarily going to encourage that from a cardiovascular point of view, but some people they'll say, well, if I eliminate dairy, my symptoms are better, and that's fine. Other people, they eliminate gluten. Some people live on vegetables. Some people live on. I know patients with this disease that swear that a meat-only diet. So there is no one specific diet that ameliorates symptoms in any specific individual. This is where it's important that you do an elimination diet and you find out yourself, and of course get good dietary counseling from a dietitian on this as well.
Right. It seems like this is very much a disease that is unique to whoever has it.
It is. It is an individualized disease. You're absolutely correct, Jeff.
So, okay, I've been diagnosed. How does one go on living with Crohn's or colitis? What kind of treatment options do we have?
Well, 25 years ago, when I was still in medical school, all we could offer people with ulcerative colitis or Crohn's was basically steroids, prednisone, and surgery. Fortunately, roll the clock ahead 25 years ago, and particularly over the past 6 to 7 years, there are many more therapeutic options. So in addition to steroids and surgery, today we can be offering aminosalicylates, immunosuppressives, biologics, drugs that tend to depress the immune function so the body doesn't attack itself. Many people with Crohn's disease and ulcerative colitis live very productive lives. The disease tends to wax and wane. You have periods where you're good and periods where you're not so good. And some people may only have one flare-up. Unfortunately, other people may have many flare-ups during the course of their disease. But one of our challenges, Jeff, and I is to take this disease out of the water closet. And I applaud you for making this announcement on CJAD tonight.
Well,
I
know that the city was. I know the city was concerned. So, but no, it like I say, when I was diagnosed, particularly from my family, I must say, it was immediately, well, your diet must be terrible, and you're going to have to change all of this, and you're going to have to do that. And then when given some of the information from the doctors that treated me, I just found it all to be quite untrue. And as I would, see people, and they would say, "How you doing? What's going on?" And I would tell them it would always be the same types of things. And so I figured the best way to start making some headway on things like this is to talk about it. And what better place than here on CJAD?
Well, you're right, and you're doing a great public service by lifting this veil of silence. It is very important you identified at the beginning of the program that there is some rather dubious information out there, particularly on the Internet. It's very important to go to reputable sources of information. CCFC.ca, Crohn's and Colitis Foundation of Canada, CCFC.ca. We link to a number of reputable sites. We ourselves develop educational materials that are vetted by physicians and nurses, and that is reputable. And when someone is drowning, often everything looks like a life preserver. So
Right.
It's very important that people not be given false hope, and even worse, people don't seize upon something over the Internet that may in fact be dangerous to their health. So very important to link up with reputable sources of information.
Absolutely, and as always when dealing with anything medical, the even better source of information is, of course, your doctor. So,
absolutely. People with these symptoms that we described, and certainly when they have been diagnosed with inflammatory bowel disease, need to be under close medical supervision in order to get the treatment and care that is best for them. You live in a wonderful city in Montreal. Has some great physicians, research facilities. I know the Crohn's and Colitis Foundation of Canada funds many of the GI doctors and researchers in Quebec and in Montreal at McGill, University de Montreal, and University of Sherbrooke, just to the east. And so you're blessed with a number of great options, and you should take full advantage of them.
If I had to get colitis, I'm glad that it was in Montreal.
Well, that's one way of putting it. We also have a very active chapter structure in Montreal that you can find out more at ccfc.ca. A number of educational events as well that help lift the veil of silence on this disease that is too often hidden. And we have great support in the Montreal area. So don't forget, June 9th is Gutsy Walk at Claude Robillard Sports Centre. And on April 14th, we have our All That Glitters Gala in Montreal. And these are some interesting events. By getting engaged with the Crohn's and Colitis Foundation of Canada or another reputable organization, you tend to get good information from people that have learned the ropes. So I would definitely encourage that.
Fantastic. Dr. Kevin Glasgow, CEO of the Crohn's and Colitis Foundation of Canada, thank you so much for joining me tonight.
Thank you. Merci beaucoup. À la prochaine.
And to you too. ccfc.ca is the website to check out for more information. Quick break, and we'll be right back here on CJAD 800.